All right, so we are live. Good afternoon, everybody. Good evening and good morning. Everybody's going to take the time to watch this. Let me do this a bit. Yeah. So it's a beautiful Monday, and today we are going to do it's a second week of April. So we are going to talk about parenting, and this time because it's an Autism Awareness Month, we're going to talk on how best we can parent our children, specifically what we should not do. Because everybody talks like do this, do this, do this, but what are the things that we can do that can really, really harm our children? And today I'm privileged to have Dr. Lilian Kerubo. So the first time she's here, so those who have been here long enough will remember her. But I would want her to introduce herself and you'll understand why she's the perfect guest. Dr. Kerubo, Karibu.
Asante sana, Dr. Lema. So my name is Dr. Lilian Kerubo. I am a pediatrician, I am a mom, and I'm also a behavior therapist. So autism and other forms of childhood behavioral challenges are very central to my heart, especially in Africa. So I'm very happy to be here and I'm very grateful for giving me this opportunity.
Thank you. Thank you so much for accepting, especially for such a short notice. I don't take that for granted. Asante sana. So, raising a child, parenting is not easy. I mean, parenting is a lot of work. Now, raising an autistic child is 100 times work because number one, we don't know what to do. We don't know how these kids are thinking. We don't know what they see. We don't understand them. Even research this is limited amount of information, what is known as far as how their mind works. So you can imagine a parent with whether you are a doctor or not, but now you have a child with autism, much work. So to start with, you're a behavioral specialist. What exactly is the major difference between a child who's neurotypical and a child who's actually living with autism? Of course, there are many medical things. I just wanted you to simplify it in the most simple way you can.
Okay. Yeah. So the biggest differences that we see between neurotypical children and children who are in the autism spectrum, I would classify them into three. The most common differences you'll see will be in how they communicate, in how they interact socially, and in how they behave. That's where the biggest differences come. Otherwise, everything else can be similar. And I want you to remember that the same challenges that children in the spectrum have, the typical children can also have them. Just that in the spectrum, they are more obvious, or they are more challenging, and they are a bit unique. So for example, when it comes to communication, all children are born without the language. There's no child who is born speaking, right? So all children will have a challenge in expressing themselves and in receiving instructions. However, for the typical children, you'll find that by age 1, they are able to at least understand a few instructions. They're able to imitate in case of learning, and they're able to speak back or even gesture back at what they would like in return. So a child in the spectrum may have a prolonged period where they've not acquired these skills. So you'll find that a child in the spectrum by age 1 perhaps is not able to point at something they want, is not able to articulate and say, I would like this, may not be able to respond. If you ask them a question, may not be able to respond back, and they may not be able to imitate, okay? So that's in the language and communication sphere. The other area where there may be a big challenge between a typical child and a child who is in the spectrum will be in how they interact. And again, remember, even typical children are not born knowing how to interact with other people. It is a skill that they learn the longer they live with human beings, right? So you'll find that by age 6 months, by 9 months, a typical child knows that when somebody smiles at you, you smile back. When somebody waves at you, you wave back. When somebody when you want something from somebody, you ask. That may not be so in a child who is in the spectrum by age 6 or 9 months. They'll get it eventually, but it may not be at the time that we expect them to. Then the third area that there may be differences will be in the behavior. Again, I want to remind you that even typical children are not born behaving the way we would like them to behave. It is because of how we interact with them, how we talk to them, how what we reinforce and what we don't pay attention to, that they learn, okay, in this family, we behave like this. In this family, we are polite. In this family, we don't fight. In this family, we use words of courtesy. So in a child in the spectrum, that may not be so easy. They may not acquire the behavior we would like them to have in the speed that we would like, that, for example, a typical child will acquire it. They may have other extra behaviors that we may not see in a typical child. So, for example, things like steaming, the movement, the what people call strange activities that they do. You may see them in a child who is in the spectrum, but you may not see them in a child who is typical.
Yeah. So you mentioned the word steaming. I'll ask you what exactly is steaming, because so that people are able to understand what exactly you mean by that word steaming. But
okay, so
before you respond to that, you say every child, the way we teach them to interact is based on the environment that they are going to come in. So that means there are things that we may do and actually teach them bad manners. In the way they interact, in the way they communicate, regardless of how good or how bad they are. Does that make sense? Yeah. So I think we'll continue with that, but I want you to make us understand what exactly is steaming.
So steaming is a modification of the word stimulation. So basically what we see with children who are in the spectrum, sometimes they have hyposensory input. So for example, as you sit in your house, you may be getting a lot of sensory input. For example, as you look around the house, you can see maybe the color of the pillow, the color of the curtains, the color of the carpet. That's visual sensory input. You can also be getting auditory sensory input. Maybe you are hearing kids playing outside, that's feeding into your ears. You may also be getting a sense of vibration. Maybe there's a wind, maybe there's a breeze, so that there's some movement, so you can sense that. You may be getting tactile sensation. Maybe as you sit there, you're touching something, you can feel the texture, you can feel the roughness or the smoothness of the things around you. For children in the spectrum, they may not be able to appreciate these sensations as delicately as a typical child would. So they need to self-stimulate. It's like they need to give themselves extra stimulation. Okay, so you may find them either swinging forward a lot, you may find them flapping their hands, you may find them turning around, So basically the definition of a steam or a stereotypy in the medical language is a repetitive action or sound that does not seem to be meeting a specific function. So if you look at it from a typical mind, you may think there is no function that this child is getting from this movement or sound. However, in the autistic mind, there is a reason why they are doing that.
What they're doing, and that is the power of information, because we always say the best way to live with these people is understand them, because they will not behave, quote unquote, the way you typically think this is how a person needs to behave, and whatever they are doing makes sense in their world, of which we have little understanding in.
Exactly.
Yeah. So now going back to what you said about the environment. So when it comes to communication, we can start with communication and maybe social interaction. What are the things that we should not do? What are the things that when we do to our children actually do more harm than good as far as communication, speech and language is concerned?
Okay. So the first thing we should try not to do for any child, not just the children in the spectrum, for any child, the worst thing you can do is to not interact with them. So right now, I know we are in the 21st century. We are living very busy lives. We have no time We are working 8 to 5. When we come home, we want to fix dinner, we want to watch the news, and then we want the kids in bed so that we can maybe watch one episode and then also go to bed. So there's really no time to interact. And interaction does not mean you are seated over there, I'm seated over here, we are throwing words at each other without looking at each other. That's not interaction. Interaction means our phones are down, our books are down, TV is off, we are looking at each other face to face. I'm asking questions, you are answering, you are asking questions, I'm answering. It is a feedback mechanism. So one of the worst things we can do is to not interact with our children. And we have to be intentional about our interactions. We have to find time. We have to decide what we are going to talk about. We have to decide what questions we are going to ask. And we have to decide that we are going to listen, not just ask for the sake of asking, but we're going to listen, we're going to understand, and we're going to remember what exactly they said. The other thing that we should not do is to compensate for lack of time to interact by gadgets. Yeah. That should not be the case when it comes to children, especially during their formative years. WHO actually says children should not interact with gadgets for more than an hour per day. So most of the time, because we are too busy, we give them a gadget, we give them an iPad, we give them a phone, we give them the TV to fill up those hours or those times where we are not able to interact with them. This is a problem because most gadgets or most apps are not interactive in nature. They are just cartoons moving on the screen. So the child just literally gets hooked. The mind is transfixed on the whatever is showing on the screen, and they're just watching things moving past them. They are not given a chance to speak or to give an opinion on whatever is happening on the screen. So basically the screen is running their mind. So that's another thing we should try as much as possible not to do, giving our children too much gadgets. The other thing that we should try not to do is early institutionalization. What do I mean by this? Sometimes because we are busy, or we have been frustrated by nannies, or basically our lives are, maybe you want to travel, you want to, your job is very demanding, you can't be at home every day. We decide to take our kids to either school very early or boarding schools very early. This can be very harmful for the child, especially if the foundation of speaking and communication has not yet been it has not yet taken root in the child. It can be dangerous to institutionalize the child too early, and we can debate about when is the right time. The government of Kenya recognizes 4 years old as the right time. However, for children who are in the spectrum, children who might have cerebral palsy, you may need to introduce them a little bit earlier to a kind of child setting so that they can develop their skills. But try as much as possible not to institutionalize the child too early, before speech has commenced, before behavior has set in, before social skills have been acquired. It may not be time to institutionalize the child. The other thing that we want to try not to do in the very early stages is to be poor role models. There's a common saying that says, you can speak all you want, but I'm watching your actions. And that is very true with children. You can tell them all you want, or be kind, or look at people's faces when they're talking to you, or keep eye contact, or shake people's hands when they come to the house. You can do all the talking, but if they're not seeing you do the same things, chances are they will not pick up those behaviors that you want them to pick up.
Well, thank you. So now I'll take you back to the institutionalization, because there's so many articles actually that have been written, and they say these are not kids on the spectrum, but these are just the general kids who have been taken to school early, are the kids who are seen to be most rebellious. They're the breakers in schools, and it's purely because they feel neglected and they feel they need more time to, like, they felt like they were rejected, like school was a way of punishing them, quote unquote, rather than them being taken there to learn anything. So yes, all parents, whether you have a child on spectrum or not, try your best. We understand life happens, but really just try your best. Assume you were living in 1980s and there were no all these group and play whatever's, what would you have done? Yeah.
Exactly. Yeah. And we are so lucky in Africa that we are still community based, such that you can find somebody, you can find a grandmother somewhere, an auntie somewhere, you can find somebody, who you trust, and who you can leave your child with for a few days, a few weeks, if need be. Somebody
Mm,
who will instill the same values that you would have done as a parent.
yeah.
Yeah.
Oh, okay. Thank you. So now moving on.
Yeah.
One of the things that I've really had, actually, last week I did a topic on the basics of autism. And I think I've had 3 parents ask me, will my child ever talk? Um,
Mhm.
will my child ever talk? So are there ways you can predict?
So we are not able to predict. You cannot see a child at 2 years and say this one will talk, this one will not talk. In
Okay.
fact, very many children in the spectrum surprise us when they say their first word, because there have been
Oh,
children who have been written off, people have said this child will never talk, and then
mm,
one day they just surprise you.
we
They
decide to
just release a whole
talk.
sentence. So
Mm,
you cannot predict who will talk, who will not talk. However, all children will communicate. They will all communicate.
yes.
And I
Yes.
know it's very hurtful when a child is not able to talk, especially
Yeah.
as parents. It's
Mm,
it's it's very confusing when your child is not able to utter words. However, it's important to note that all children can communicate.
mhm.
Communication is not just speech.
Yeah.
Communication can be facial expression, it can be gestures, it can be picture assisted communication, it can even be
Mm,
communication through a device. So
mm,
all children will communicate.
mm,
Maybe not all will speak out words, but
mm,
all children will develop a means of communication. And if you are keen as a parent, will be able to understand your child, and you'll be
mm,
able to kind of create your own language, just the two of you, where you are
mm.
able to understand each other. The child will understand you, and you will understand the child. And
Sure.
that's all we need in this world, for people to understand each other. Yeah.
Yeah. Yeah.
Yeah.
Thank
Mm.
you. Thank you so much. And
Mm.
um the age, does the age matter?
Mm.
Like, for example, if you are seeing a 10-year-old boy or girl,
Mm.
they are on
Mhm.
the spectrum and they are not able to talk.
Yeah.
Is there a moment you can, is there a point where you can say, okay, I'm not sure? When, okay, maybe I should be, okay, when do you start telling parents that maybe they should start considering things like sign language or just other
Yeah.
forms of language? Because somehow they need to go to maybe some type of school or therapy
Yeah.
where they will be able to communicate with another person other than the parent in this case.
Yeah. So we don't have an age. However, there are things we like children to accomplish by a certain time. So, for example, for children in the spectrum, of course, you want them to join school.
Mhm,
Preferably, you want them to join mainstream school if possible. Of course, for
mhm,
the very severe ones, sometimes they may need special attention. But for majority of children in the spectrum, we prefer that they join mainstream school.
yeah.
So obviously, by the time a child is joining mainstream school, and if
Mm,
they are non-verbal, and by non-verbal, I think the medical definition is having a vocabulary of less than 20, or is it less than 30? So if
mm,
they are non-verbal at the time of joining mainstream school, it may
mm,
be time to consider an alternative means of communication.
okay.
However, that will need to be informed by so many things. First of all, is the child on speech therapy, and how
Mm,
is the progress? If the speech therapist says yes, they have a limited vocabulary, but they are building, we can wait it out. But if
yeah.
they've been on speech therapy maybe 2 3 years, and the speech therapist is saying, I'm not seeing acquisition of words, that may be a time now to start an alternative communication strategy. So there are key things that you would like to see by the time a child is joining school. You would like them at least to be
Mm,
able to, they don't have to speak a multiple of words, but they at least they need to be able to ask for help. They need to be
mm,
able to ask for food. They need to be able to say when they want to go to the toilet. That's just basic things. Yeah. So I would say school age at entry of school is an important factor to consider. We also consider things like separation. For example, if the child is now a little bit grown and you want, as a parent or as guardians, to kind of separate, maybe to give them a little bit of independence, if by the time they're separating from home, if by the time they're leaving home, they are nonverbal, again, this may be a time to consider an alternative means of communication. So I wouldn't say it's age dependent, but it's mostly milestone dependent or achievement dependent.
Okay. All right. And you talked about if a child is on the spectrum, you may recommend that they start school a bit earlier than 4 years. Would you have like an age, like, and maybe a parent is watching and they're asking, so should I take my 2-year-old boy or girl to school because they've not developed any form of speech and I think they're on the spectrum? Do I wait for 3? Do you have any age that you would recommend in this case?
So again, it's not age dependent. However, several things need to have been done before we make the decision of early intervention. We don't want to call it school. We just want to call it early intervention. Because if you call it school, then some people will look for a literal school for ABCD, and that is not exactly what we are looking for. So we're just looking for early intervention. So if hearing assessment has been done and the ears have been given a clean bill of health, the examination, the mental assessment has been done, and this child is otherwise cognitively well. There's nothing else impairing their understanding or their brain activity. And then basic things that the child needs to be able to do before they join a program that separates them from the parent for a period of time. Is this a child who can, for example, tolerate being outside the home? Because some children take a little bit of time to adjust to a different environment. So you have to understand this particular child. Are they able to stay maybe 2-3 hours away from home? Will they adapt easily to the new environment and to the new people who will be surrounding them? How is the feeding? Are they able to eat, or even if they cannot feed themselves, but if somebody feeds them, will they accept the food? Because you don't want to send a child away and then they go and starve. So those basics, if they've been met, I would say this is a child you can. I've seen children going for early intervention as early as 1 year. There have been children who've gone for early intervention, especially in the West, because they're able to diagnose autism very early, even up to 6-9 months, 9 months. They have diagnosed somebody with autism. By 1 year, they send this child off to early intervention so that they can get their social skills ahead. They can get their speech going. They can get their comprehension going. They can get their self-care routine going. So I've seen as early as 1 year. I think 1 year is the earliest I've seen. So it depends on a lot of things. Yeah.
Okay. Well, thanks. Thank you for that. So we go back to communication. As you say, every child communicates as much as they may not use speech
words
and language as we know it. Yeah.
Yes.
So behavior, how the baby behaves or how a child behaves is also one of the way this baby communicates. So if you see a child tantrum, a child is distressed, a child who keeps on flapping, it means there's really something going on. So I'd want to make us understand which behaviors, at least the common ones that you've seen, speak distress, and which ones happiness in terms of joy, like they're happy. So I'd want you, if you can just give us an idea so that whenever we see, at least we are oriented of what is happening.
Okay. So I'd like us to always remember that children in the spectrum are number one, children. Before we put autism on them, they are still children, just like all other kids. So just like all other kids, when they are happy, they will laugh, they will smile. People think that autistic children cannot smile. They smile, they laugh, they shriek. The way children, if you take them to a slide, they're like, ah!
Wow.
Same as the children in the spectrum. The pitch may be different, the tone may be different, but they also express it like that.
Yeah.
There are children who self-stimulate when they are happy, like they can flap their hands when they are happy. So those are some of the ways that children in the spectrum show happiness. And then distress can, just like any other children, crying is a sign of distress. Tantrums are a sign of distress. Throwing things around and becoming irritable or non-cooperative, those are signs that something may be wrong. Again, there are children who will also self-stimulate when they are distressed. So it takes upon us as guardians to really understand our children. Yeah.
Okay.
So those are some of the behaviors that show
Okay.
the mood.
Okay. So, like, speaking from my own experience, when my son is annoyed, he will talk. He will talk like even for 10 minutes, just talking. Yeah, he will. And at that time, if for any reason, okay, there are times when you can, like, if you hug him, he will calm down.
Yeah.
But if, let's say, it's a sibling who has annoyed him and maybe they were fighting for something and then he lost, he will start even crying. He would even want to now start fighting and hitting. Yeah. So, okay, it may be easier for verbal, for a child who's verbal, but I'm imagining, actually I saw a clip today of a parent, a mother with a son. A son is about 10 years, and he was really mad. Of course, he was saying, Nitampiga, I want to hit that boy, and he's pointing at the door. So the mother was really trying to calm down. So I'm just thinking, in this situation, what are we supposed? First of all, start with what are we supposed not to do? Then we'll go to what are we supposed to do.